Dr. Paul Jared Frank is the founder and director of the Fifth Avenue Dermatology Surgery and Laser Center, located in New York City. Performing over 300 liposuction cases each year in his state-of-the-art facility, Dr. Frank and his staff provide a fine-tuned environment where patients can safely and effectively address their cosmetic needs. As a board-certified dermatologist and dermatologic surgeon, Dr. Frank has become renowned in both the academic and public media for his expertise in minimally invasive cosmetic surgery and tumescent liposuction. With the rapid progression of cosmetic technologies, Dr. Frank continues his ongoing research as a consultant for several aesthetic companies and is an assistant clinical professor at New York University Medical Center, where he directs the cosmetic surgical clinic for training residents.
Hello, I'm Dr. Paul Frank, Director of the Fifth Avenue Dermatology Surgery and Laser Center. Today we'll be talking about tumescent liposuction, which essentially means fat removal under local anesthesia. This is not a new technique, but one that was invented by a dermatologist approximately 20 years ago, being performed ever since safely and effectively. What is new and exciting are some of the newer technologies that make it quicker and safer than ever. You may have heard of VASER Liposelection, Smart Lipo, Lysonics, or Powered Liposuction. Each one of these represents a different brand name of technology that essentially do the same thing, aid in the removal of fat by melting it first with heat and vibration. When combined with small microcannulas, we make for an even better technique than we've been using for 2 decades. Ultimately, there are 3 things that will make an excellent cosmetic result. First off, a good candidate. Liposuction of any kind is not meant to reduce weight, but ultimately to remove localized areas of fat that are resistant to diet and exercise. Second, using strict tumescent technique. With only mild sedation, local anesthesia, and an awake patient, we have safe and effective results. And finally, an experienced hand, one that knows how to sculpt out the tissue to give an ultimate aesthetic result. Thank you. Okay, my friend, we finished most of the pre-op. This is the fun part where we get to draw out on the belly the exact areas that are bothering you. Your blood work is good. We have someone picking you up. We did a physical exam. We gave you a little bit of a Valium type medicine to keep you calm. So let's get to the important part, start drawing on you. Okay? The incisions are going to be very, very small. They'll heal up without any stitches whatsoever. And within a few months, they will be totally unnoticeable. This procedure is about access, getting at the areas of the fat from every angle that we need to make sure that the skin lies nice and flat against the muscle. Let's turn you around.
Okay. Do you want hands up a bit?
Yes, please. After this part, we're going to give you a little bit more medicine, and then we're going to get you into the room, make you comfortable, and we're going to start the process, the most important process of filling you up with local anesthesia. You will be pleasantly relaxed, but you will be awake, so you'll be able to follow instructions, have me move you around, and really sculpt you out here. The only discomfort you will feel will be quite similar to going to a dentist's office. You got to get the shots before you get your teeth done. So it should be the only level of discomfort that you have. Once you're numb, I'll be able to do whatever I need to do without you being in any discomfort whatsoever. This is the important part here. We're going to get you numb. I'm going to give you a few pin pokes here of local anesthesia where I'm going to make my little incisions. You're going to feel a little poke. All right. Now this part of the procedure is very wet. It's all just local anesthesia. I don't want you to think that any of this is blood whatsoever. It's actually quite a bloodless procedure. Now I'm going to make the holes. You shouldn't feel much of this. Okay. So we have a very tiny instrument here that pumps through local anesthesia. I'm going to be placing it under the skin. You're going to feel me pinch you a little bit. And what this is going to do, it's actually going to break up the fat a bit and numb you. These little marks are going to close up without stitches. They're very, very small. They just have to be big enough for my instruments to go through. Now during this part, you're going to feel very wet. None of it is blood. It's all just a local anesthesia. Unfortunately, you have to get bigger before you get smaller here. I'm separating the skin and the muscle and spreading out the area where the fat is, which makes for very safe removal. The goal here is to do the least amount of trauma to take the most amount of fat. You're nice and numb now. You've been sitting for about 15-20 minutes. The area is prepped, and now we're going to use with the VASER Liposelection cannula. What this is a very thin ultrasonic wand that's going to help melt the fat. There are several technologies that melt fat. They all do the same thing. They produce heat and motion to help break up the fat tissue and minimize any form of bruising or trauma to the skin. There is some evidence to suggest that the heat also helps tighten the skin a little bit. I've used all the technologies, and in my opinion, they all really do the same. In general, I prefer the VASER mostly because it has the longest history of use. Ultrasound has been used in medicine for decade upon decade, and the instrumentation is very, very small now. I've yet to see any problems whatsoever with several years of use. There are many patients who don't require any sort of melting whatsoever. If you have soft fat, obviously, the less you do, the better. So in general, men who are small like yourself tend to have a little bit more fibrous fat, so I'm going to do a little bit of melting through one of the very small holes. Okay, I got it, Liz. Thank you. And here we go. It's going to sound like you're getting your teeth cleaned. It's ultrasonic sound. Are you in any pain?
No.
Good. I'm just very gently breaking up the fat, delivering some heat to tighten up the skin. And as you can see, I'm moving very smoothly here. There's no jabbing. There's nothing of that nature. I refer to tumescent liposuction as more like playing a violin than working a jackhammer. The more trauma you do to the fat, the more risk you have of problems with the skin. And this is something that really could be totally avoided with the local anesthesia technique, with or without some of these melting technologies. You're doing very, very good here. There's actually some fat dripping out already, and that's what you're feeling warm go down you. Okay, my friend, we're actually going to take out the fat now. This is the easy part. And what I'm going to start with is what's called a microcannula. These have come a long way from the images of liposuction people have had years ago with like the big jabbing. This is actually going to be all in the wrist. There are several different types of instruments of different lengths, of different sizes, different amounts of holes. But this is about the average size, and we should be able to accomplish most of what we need with something as teeny as this. You will feel my motion, but if you feel anything out of the ordinary or painful, please let me know. I can adjust your position. This is actually the advantage of having an awake patient. You're part of the process here. Okay? My patient here is actually quite awake, which is, as long as he's comfortable, I'm comfortable. There are times where I'm actually going to sit him up. Now, you are quite small. Certainly can do patients much bigger as well. But sometimes it's people that are in almost perfect condition that really take the most sculpting. Okay, my friend, tight as a drum. Looks great. You have no bruising, and it's nice and flat. Now, I'm going to turn you over. We're going to start working on the sides, okay? Very good. At any moment you feel any jabbing or anything that you can't tolerate, by all means let me know. Seems like you're doing fine. Sometimes the back is a little tight. Sorry. Next time I'll try and induce pain. I'm sorry that I'm tickling you. It's coming out beautifully. You can see it going down already. Just gently massaging out the fat. You don't have a single bruise on you. Looking very good. These holes are going to close up beautifully. You can see the shape the love handle conforming already. This is what sculpting is. What I want you to do, let's take this away. I want you to grab my arm, and I want you to gently slide down. You're going to come over here. Try not to move. Unless you feel discomfort, you'll let me know. Get shut off suction, please. All right, it's about as good as it gets. Let's take a look at you from behind. All the way, turn all the way around. All right, well, you're coming in now. That sounds fine. Very good. Okay, my friend, you're finished. Let's shut off suction. Take a seat. Okay. So how you feeling?
Great.
Good. We did amazing. I expect you to be a little bit groggy now. You have this tight garment on. This is going to stay on with the bandages for about 36 hours. Tomorrow night you'll take it off, and we have everything written out for you in terms of post-op instructions. We're going to give you a few days of antibiotics. You should not need anything else other than extra strength Tylenol. I want you to continue staying away from things like Advil and any other pain medicine. Truthfully, I left a little local anesthesia in there, so you should feel fine tomorrow. We gave you all the antibiotics you need. We give you all the checklists of information you need for post-op material, and I'm going to see you in about 4 or 5 days. So you should be in no pain right now, and we got about 2/3 of a liter of fat. If you could picture a liter of Coca-Cola, we got about 2/3 of that. So that's going to totally change your body shape.
Thank you very much.
All right, my friend?
Thank you.
Okay, I'll see you in about 4 or 5 days, all right?
Okay.
Good. How'd you do?
Great.
Okay. Any pain?
None.
Were you able to get back to your activities pretty quickly?
Yep.
Okay, let me have you stand up. Let's take a look here. You've been wearing this garment pretty much 24/7 since the procedure 4 or 5 days ago.
Yep.
All right, exactly what we should see. Puffiness, which is normal. The fat is gone. You have no bruising. Your little holes are closing up. Some areas you see the end result quicker than others. And right now you should be seeing about 40%. You should have some mild tenderness. I'm actually surprised you really have no bruising whatsoever.
I had none.
You'll be able to get back to your activities as tolerated, so you can go back to the gym, go back to vitamins, pain relievers, anything that you normally did before you could certainly do now. I think in a week or two you'll see about 80% of your end result, and then for every week after that it'll only get better up until a few months.
Great.
Okay? All right. Let's get this back on and get you out of here.
Thank you.
All right.